should be, of course, you want to be healthy, and if you are healthy, then probably you also be happy. At the same time, yeah, you need to have that quest for knowledge to know more. Uh, can you decide everything of your own, or are you dependent upon your parents or your own friends to decide different things? And not only it is important when it comes to, when your college life, when you have to have maintaining the balance between your class hours and going back to your hostel, having food and many other things. You will be seeing purity of the mind. So we're not only going to discuss about how you should go about your college life, but also regarding like how you can have a good thought process to keep yourself updated. So this will include how and whether you are able to control your mind and control your body in various terms. And eventually, the most important thing would be to have this self confidence, whatever you do in your life. Now, there are various factors which are associated when we talk about the health, when we talk about the mind, when we talk about the balance between your working hours and the time you're going to spend at hostel with your friends. So there are various factors which will eventually decide the health and your well-being, physical and mental well-being, and those components include coming out of stress. You might have different stress. Then of course, because you are coming to the college where we have this semester based program, so you need to deal with the pressure of academics. And the most important thing here would be how do you manage your time? And that will be very, very important when you have to manage the things. You will see that in each and every semester of yours, you will have certain credits where each and every courses will have certain assignments, quizzes. So how you're going to manage your time? Then sometimes if you're not at the good state, you're suffering from some ailment, during that time how you going to manage? And of course, college is not only about learning, it's also about that when you have good time with your friends. So you'll also have some sources of entertainment. Then some other distractions would be there, like domination of one gender by other, or you're just thinking about how you're going to have the placement, many many things, because your brain keep on thinking and various ideas might come to your mind. So sometimes you are just have to come overcoming this thinking. Then you will have the peer pressure of attending classes and few other temptations you need to come over. And eventually all these components, how you balance your life, how do you come out of this, will decide that, or final your mental well-being. So you need to also have to have the balance between the anger or something now we have started characterizing known as clinical depression. So these factors are very important for your college life, and it will be very important for you to do proper time management. Now, when we talk about the body, it's something like made up of cells. For any organism, when we talk about the structural and functional unit, is a cell, and as if in humans we talk about billions of cells, and you have to think in this perspective that all the cells in our body, they are working together in harmony. They're trying to be fit in your body and trying to keep you healthy. So these cells are going to make tissues, tissues are going to make organs, and finally the organs are going to make the organ systems which define any organism. So if I have to put it in this, in this sentence, I have to ensure the continuity of that harmony, which is being formed by these cells. And this is my duty not to disturb it. So we all need to have this feeling of responsibility towards our body, that we are going to fulfill it. And basically, if we want to keep it healthy, we need to take care of our body. So how to go about it? I can just give you some ideas that I or align you towards that. So basically, if you start with the intake you do, either in a form of food or in a form of, let's say, the other factors like air, water, sunlight. So all these things which you take intake, that are very important for maintaining your health. And apart from these factors, the kind of feelings you have, the kind of thoughts you have, and kind of events or circumstances you might be going through also affect the health. And that is very important to maintain the health. So going into that, what type of food you're taking, that is not only supposed to be tasty, but it also have to have the nutritional value. It should contain the balanced diet. Then what type of like basically if you're taking water, what kind and what amount you should take water. Similarly, you need to have a daily exposure to air and sunlight. And this is an important point because nowadays, if you just have to take the level of vitamin D in Indian people, the level comes low. So that also shows that we don't go often outside, and which is equally important to have the fresh air and sunlight. Then at the same time, not only you have to be aware of what type of food you need to choose in terms of the balanced diet, you also need to know how much is required for you to eat to have that sensation of fullness. And towards the end, it is very important for you to avoid any sort of distraction by any other intake, like our senses. It could be the thoughts, it could be, overeating. So this is important to have balance in your life to keep you healthy. Now moving to the circadian rhythm, and this is scientifically proven that these are the times where you have to design your daily routine to be fit. So if I just have to look into breakfast time, which should be somewhere between 6 to 8 a.m. Okay, after that, once you move towards daytime, the lunchtime should be in between 12 to 1, followed by, because this is the time or after that which where the absorption and assimilation will take place. Then the dinner time should be 6 to 8 p.m. before you go to bed. That should be there should be a gap between 2 to 3 hours. And it is already proven that around 12 a.m. you will be in deep sleep, and in between 12 a.m. to 2 a.m. your liver will be active, and basically it is involved in detoxification or any sort of repair which is going on. And from 2 a.m. to 6 p.m., this is a time where this will also your food will be processed, digested, and finally removed later. So this is something, if you want to have that kind of harmony with the health, you need to have a daily routine, and it is important for each one us to have it. Now, apart from that, having intake and cause maintaining your health, labor or we call it shram is equally important. So when you are at the hostel, what the different things you can do towards it to keep yourself fit? You need to have an adequate movement of the body, and along with having the physical activity. And for that, you can do the simple chores like sweeping or swabbing your room. You can go for cycling, and these things will make sure that you stay in a good form. So basically, the idea is to make sure the adequate movement of the body. Now, with the food and keeping yourself aligned with the activity, you also need to think in terms of the right posture for regulating the internal and external body movement organs, and along with the regulated breathing. And for that, you can do this simple yoga asana, which will keep you or which will help you for maintaining the regular or correct posture for your body. And specifically, this point is important after what we have seen in the last few years in terms of this COVID, that many of us have moved towards implementing it in our daily life or doing some sort of yoga, specifically pranayam, to improve our breathing, which helped us a lot. Many of us got benefit from that. And finally, sometimes it's not possible. This is just our body, and sometimes probably it won't feel good. You might be having some issues with your body. At that time, you need to take proper medicines to bring that harmony back from the temporary disharmony. So, for that, you probably will be requiring certain medicines, or you will be requiring the machines to perform the body functions. So basically, you can start with the home remedies, and if the medicines are required, then you need to take those medicines. And in some cases, probably you also need the help of the machines. Like in the case where you have the diabetic condition, probably you need to take the insulin injection, or someone who is having the kidney ailments, they need to go with the dialysis. But the whole idea is that whatever disharmony your body is facing, it has to come back to the harmony. So what we have gone so far is about the intake and the daily routine which we are supposed to follow, and then it will go along with the proper exercise. Then it is equally important to have the correct posture, basically regulating the internal and external body organs with the regulated breathing. And in case if someone falls sick, it is equally important to have proper medicine and then go for the treatment. Now, coming back to the food part, the nutrition part, which is very important, to have the right food, because you might have heard this saying that you are what you eat, and that is not something, which we just say for fun. There is a scientific reason behind it, and we're going to talk about some of the scientific studies which are being done, which actually confirm. And what are those? How do we study that? But today we'll be focusing upon all the basic idea and basic information related to it. So when I talk about the nutrition, we are talking about the eating for optimum health in a college setting, and where why do we need to eat? So if you just have to assess your eating behavior, of course, to because of the appetite we have. Sometimes it may be also related to, this, whenever you are feeling any sort of emotional discomfort, you need food to have some sort of comfort. It is only for maybe sometimes you just having some issues that you feel like eating. But in general, what drives us to eat is to fulfill our appetite. It could be something related to habit or custom, that during cultural festival you take some food, and then basically you to take food for some nutritional values. So nowadays we are also looking into different type of diets, like including keto diet and few other diet. So some people also tend to take that. So it could be the various factors, but essentially it is, the part of your regime, because of your appetite you need to eat. Now, if we look into the calorie range, and this is something, a standard calorie range for the children, for the females of different ages, and for the males of different ages. And based upon the calorie range and the weight, the BMI also have been defined. So, other than the food items, which will consist of protein, carbohydrates, fat, and fibers, we also need to consume water to avoid any sort of dehydration. And basically, we know that water is the major component of the blood. It is necessary for as a, maintaining the pH in our body and transporting of the cells and oxygen. So recommended one or six glasses, 6 to 8 glasses per day. And essentially it consists of 50 to 60% of your body is actually water. So there is a question for you. What do you think, is bottled water better, or one should go for tap water? Right? So you should think about it and answer the question. Now, moving to the nutritional part of the food, the major important part is protein. And this is actually the second most abundant substance present in humans. It's key to every cell because if you look into the functional part, they consist of proteins, antibodies, enzymes, hormones. They are actually proteins. There are proteins like hemoglobin, which transport oxygen and nutrients. Some other nutrients also require the proteins. Proteins play an important role in development. They are the building blocks. Different proteins, like which are present in muscles, skin, they are basically the functional units. And at them, you can say that these are vital for human life. And in some cases, you might need additional proteins if you have to fight off the infection. If you are having exposure to any type of bacteria or virus, you need to fight off with those external harmful particles in a form of production of antibodies. And what are antibodies? Antibodies are actually are also proteins. Okay, so you need proteins for that as well. We already know that proteins are made up of amino acids, and if we look for us, there are 20 amino acids, essential amino acids, and these must be obtained from food. And there are 11 non essential amino acids which are produced by the body. So we have both complete proteins which supply all essential amino acids, and there are some incomplete proteins which may lack some amino acids, but these can be easily obtained from different sources. Then the second, probably which is more common in our diet, is carbohydrates, because being Indians, we do eat a lot of chapatis and rice. So why do we need carbohydrates? Because these are considered as the best fuel. They provide instant energy. So for the quick energy, probably you will be depending upon the carbohydrates. And they are of two types. They could be of simple sugars, or it could be a complex carbohydrates. So simple sugars include the monosaccharide, or it could be the disaccharide, and the most common one is the glucose. Apart from that, if we move to the complex carbohydrates or polysaccharides, that includes the starch. So basically, starch you can get from flour, you can get from pasta, potatoes, they all contain the starch. And this starch can be stored in the body in the form of glycogen. Apart from that, it also consists of fibers. Then you also need fats, also known as lipids. So basically, these are also important. It's not that you should not include fats in your food at all. That is not right. But this is also required to maintain the healthy skin, basically to insulate your body organs, for maintaining the body temperature, promoting the health cell function, and they carry the fat soluble vitamins A, D, E, K, and they are the concentrated form of energy. Because once initially, if you take carbohydrate, that is the quick instant energy you can get. But if you don't eat for some time, a few days probably, then the fat will be the source of the energy. Now, this is just a saying of Mark Twain: the only way to keep your body fit is to eat what you don't want to, drink what you don't like, and what you don't rather not. So, this is by Mark Twain. Now, I just want to talk about, if the things which are related with the COVID-19, and how this COVID-19 data, what we have now, because you all know, you have seen in last few years, probably you might also have seen the incidents in your family. how it is associated with the excess weight. So this kind of study was being done since it was the pandemic, and the researchers try to find out whether this COVID-19 condition related to excess weight or just opposite. So in some, they already have identified the cases, the patients having risk of severe illness, triple the risk of hospitalization, and then in some cases, obesity is linked to the impaired immune function, and that means that their immune system was not working fine. Then obesity also decreases the lung capacity, and that means that if the person is obese, they probably will have non-functional lung, or the lung will not function perfectly. So that is also there. And apart from that, as BMI increases, that increase the risk of death from COVID-19. So this is also depending upon the data which from the CDC, where they discuss about the correlation between COVID-19 and how it impacted the life of the people who come under this category of obesity. Now, this obesity may be linked to lower vaccine responses also, and this was the important point when it comes to these virus infection, including influenza, hepatitis B, and tetanus. So, for this, they have already basically published that, or they came up with the data where they have done some analysis in the patients, where you might have seen the different vaccines which were available in the market, Covaxin, a vaccine from Johnson and Johnson. So Pfizer vaccine, they said that their vaccine may be less effective in people with obesity. So as per their study, um, in their study they mentioned that. So since this is obesity is related to the eating disorder, so how well did we do avoid obesity during pandemic and social isolation? Did we have report of many people going through obesity, or was there a different trend what has been seen? So, as per the report published in 2021, for this particular report, they talked about the impact of COVID 19 stay at home on health behaviors in adults. For this particular study, they have enrolled around 8,000 participants, and during that study, they also defined how many of them were having normal weight. Like in the study, 32% had overweight, and 34% of these participants were actually suffering from obesity. So, among these participants, weight gain was reported in 27% of the total sample, compared with the 33% in participants with obesity. So at least they could see that around, you can say that people who gained weight also had the largest decline in physical activity. So they could see a clear indication the people who did not just sit at home, didn't do any physical activity, and they had the weight gain. But the good news is that it's about 17% of the study population actually lost the weight during the pandemic. And that is not surprising because they kind of improved their physical activity levels and also improved their diets. So diet is directly correlated with certain, diseases, including obesity, and obesity is a major concern when it comes to US and to some extent in India as well. So when we talk about the mental and physical well-being, the second point here is how effective is exercise as medicine? Because for treating any disease, if you are on medicine, but what else can you do? See, this study is also being done where they have compared people who were rather sedentary and not much active versus those who were active and doing certain sort of exercise. Similarly, in the people who were considered as overweight versus lean and were doing exercise, so there was a clear cut difference in in terms of mortality rate, as well as how they kind of basically responded to any particular drug or any particular condition. So there was a clear cut difference that people who do regular exercise and were lean, they responded better in comparison to those who were sedentary and having overweight. So this data, if you want to access and you want to learn more about nutrition, physical activity, the condition related with overweight and obesity, what is the major difference between overweight and obesity, what is actually healthy weight, all this information you can get from Centers for Disease Control and Prevention. And this is the center which initially comes with the idea of what type of vaccine one should go for. So this data is available here. Now, if we just have to define the obesity, it's a complex disorder which involves an excessive amount of body fat. So, if, like I was mentioning, there is a difference between overweight and obese. So, we can define it in terms of body mass index. So, if it is between 25 to 30, you tend to be overweight. If it is more than 30, then you come under the condition of obese. Okay, so and this slide here shows you, if you really want to calculate, you want to know your BMI, you can use this calculator. You can put your height, it is just based upon your height, feet in inches, and then your weight. And if you just put the information here, you would be able to calculate. Now, so on the basis of what the data which is already available, it talks about if the BMI is less than 18.5. Of course, this all BMI are based upon specific age, because from one age to another age, it is going to differ. So BMI less than 18.5 in this case for the adults, it is considered as underweight. If it is in the range of 18 to 24, this is rather normal or healthy weight range. If it exceeds from 25, in between 25 to 29, we consider it as a overweight. And if it is more than 30 or higher, then you have to worry because you will come under obese range. So this data is from National Heart, Lung and Blood Institute of wing of this National Institute of Health, and based upon that, they have come up with the healthy BMI, and which should be in between 18.5 to 24.9. So basically, for this data, you need the height and you need the body weight, and then you can calculate, and that will give you the range whether you falls in a normal or healthy range or you fall in any other stage. Now, why we are concerned about obesity? Because this condition increase the basically it increase the risk factor of morbidity from various other ailments. It could be related to hypertension. This could be related to condition known as diabetes, type 2 diabetes. This is directly associated with heart disease, stroke, in some cases, gallbladder disease, osteoarthritis, something related to your bones. It could be also associated with sleep apnea and respiratory problem. And there is a direct correlation also have been mentioned in some cases where incidence of cancer are more in the obese people. So obesity is also associated with the increased risk in all cause and cardiovascular diseases and mortality. So basically, the direct correlation has been seen And for these kind of studies, probably they'll be taking two different groups, people who are obese, which comes under that obesity. And like I showed you the previous data, that they would be calculating the BMI. And on that basis, they will be classifying it into two groups, where one group will have the normal BMI and will be healthy condition versus those which are under obesity group. And once you compare the incidence of different diseases, including the heart diseases, the cardiovascular diseases, as well as certain types of cancer, the incidence will be significantly higher in the people who are suffering from obesity. So this figure shows you the data from National Cancer Institute, which talks about that certain uh, cancers have been linked to overweight or obesity. So, especially the cancers which are associated with the obesity include something related to your diet. So, diet plays an important role, like I mentioned before. Also, not only it is important for you to be healthy, but also for your mental well-being, the thoughts you will have, the purity of your mind. So here this data shows that these, for some cancers, we know that the association is there with the diet, and especially breast cancer, colon cancer, prostate cancer, all these cancer have been associated, that people who are overweight tend to have the incidence. Now, other than this, when we talk about the diet, we talk about the health condition, and we talk about the mental and physical well being. Another important factor for you to remember is that uh, we are also concerned with the aging. So, can we discuss about why we age and why we don't have to? So this professor David A. Sinclair, he has come up with some data and a book as well, which talks about the nature turning back time. So basically, he discussed about how we can work upon aging, and how does the diet plays an important role when it comes to aging, and is there a way to basically reversing it. So he has his own data to talk about it. I just wanted to share this because anti-aging is a big market now, where we talk about various products and we talk about various factors. So, since this today lecture basically is focused upon that, how do you deal with the diet? How would you deal with the the mental well-being? And coming back to the factors which I was discussing before, the most important factors are that how you can be healthy and how you can be happy. So I have discussed so far regarding how you can modulate your diet and how you can eat well in terms of the nutrients, in terms of the proper diet you should take, as well as how you can keep yourself healthy in terms of having a good thought. And for that, you need to have some physical activity as well on the campus. You can have various means. In the second lecture, which I'll be taking on Monday, I'll be basically talking more about the scientific data and scientific theories, which talks about the correlation of diet and health. And another important and interesting factors which I'll be sharing in the next lecture would be basically associated with that how these the choices you make in your life today in this generation actually affects your next generation and so on. So when we make a choice regarding our lifestyle, regarding our food choices, regarding your not only food choices, since we are talking about the mental well-being, the choices we made to have the friends around us, or staying like at night or something else. All those choices will make a difference. So we'll be looking into more scientific, and I just want to give you some more intro to that, is that there is a scientifically proven ideas and theories which talks about that your genes and your DNA, how well it responds to like food you eat, of course, and how like your health condition. Genetically, it will be defined, of course. The genes you carry from your parents, as a human being, we are diploid organism, and will carry the genes from both your father and your mother. So the genes we carry, and then how do you and the genes, environment, diet, everything will decide your final health condition and your mental well-being. But these choices are important in terms of that how you take it forward. So we're going to talk about that if the bad choices are being made, how these will impact your next generation. So we're going to look into few more examples that how you can actually control it, and why you need to worry while making these choices. And then the factors which I already have discussed, will just go into a little bit more, details, because these are important when it comes to making a balance in your life. Since most of the time you will be spending in the classroom, listening to your lectures, and each and every course, if they have the every teacher will have its own way of teaching, where they will be giving you certain assignments, quizzes, and they expect you to do it on time. Apart from that, there are some activities you will be doing along with your academics. So there has to be a way of how you're going to balance all these things. And when you in the process of balancing, this may lead to stress. So how do you manage the stress? Are you able to identify that you feel that stress? Are there any markers to identify the stress? And apart from that, once you have this kind of markers where you need to deal with stress, uh, are you able to identify the change in your behavior? Because that is equally important. That if you can identify the changes in your behavior, are you able to talk freely with your friends or to your family, and how you deal with that? So, um, for the academic session, you need to be present. Like your attendance should be 75% if you have to appear for the exam. So there will also be a pressure of attending the classes. Then sometimes you really don't want to go to the classes. So how do you deal with these kind of situation? This is also equally affecting. Basically identified and will be affecting your final, basically your health. So it will be combination. What I'm trying to tell you here is it will be the combination of various factors. And how do you deal with this various factors of having the positive attitude, by taking the right meal, by having a good environment, choosing the friends which will have a positive impact on you. This will all decide the final, behavior you will have towards others. And anything which you choose here, uh, which is basically associated with your health, mental and physical health, will have impact on your future life. So have this message with this message, I would just like to end the whole thing here. And like I mentioned, that I'll be discussing more about the scientific, you know, theories and the data, which talks more about the diet and your mental and physical well-being. So that I will take it on Monday. With this, I would like to thank you all for your patience and for being there and listening to this. And later on, if you have any questions or queries and you would like to discuss, I'll be happy to discuss. All right, everyone. Thank you very much for your attention. I'll be taking the second lecture in probably a little bit more details, like I said, with the scientific theories and some data. We'll be talking about the role of diet and how it can impact, and the combination of diet and environmental factor for defining your health. And we'll be looking into some data to go over it. With this, I'll just end this session. Thanks again for your attention.